For me, in terms of the role and what I'm trying to achieve, which is to give people more power and control over their own health and well-being, having people come together in this way that they're doing today, seeing some of the connections that are being made, absolutely provides a platform where we can introduce things like digital tools and using social media. But actually, you've got to bring people together and they've got to communicate face to face. There's got to be storytelling and things like that are going on, building those relationships. And from that, then we can start to introduce some more efficient or effective ways to allow people to communicate using tools. So perhaps when they're not together, they can do it remotely through their tablet device or phone, whatever they choose to use. The use of digital technology for me is there are a number of dimensions to it, but perhaps the most important to me is the more you know about your own health and well-being, the more likely you are to take control of it and do things that are going to improve your general health and well-being. So digital is a channel that allows you to access information about any health conditions you might have. The internet is a fabulous resource in terms of understanding your condition. I have a couple of ailments and I don't hesitate to get onto the internet and use those. But I think there's lots of information that's locked up in our health records that needs to be shared with us and given to us in a way that's meaningful and we can consume and use that. And also, a lot of what happens in our day-to-day lives isn't necessarily available to the people we go for particular health advice from. So actually there's a two-way thing with this, which is we can view the information they have about us, but actually as people we can contribute information back to them, managing our day-to-day lives, how we're feeling day by day, things like that. Our health record in the future will be more about us and our lifestyle and all the things that we do, and I think the digital platform allows a lot of those things to happen. So in our community, Lancashire and South Cumbria, which is the kind of community I'm part of and represent, we can't get enough people, full stop, to meet all the demand that's out there, to deliver all the services we need to deliver. Technology is a way of supplementing the resources, the people we have. But I always say, no matter how good computers get, they're never going to hold your hand when you're in crisis or you're not feeling well. So there's never going to be a situation I can envisage as a technologist where computers or VR or any of those technologies is ever going to replace a human being. But I do think there is a real opportunity to use technology to enhance the services that we deliver and to offer people a real opportunity to get more empowered around their own health and well-being. For me, there are a few things that are going to make a difference over the coming years. I think we've still got work to do with communities, first and foremost. We've got to get the concept of using technology for our health and well-being in the same context that we do online shopping and all those. It's got to be the normal way for us to do things or feel normal. I think technologies that are going to radically change the health and care system over the next few years are artificial intelligence, genomics, the power of genomics for precision medicine. I think there's opportunities around 3D manufacture and robotics. Those technologies are going to supplement and enhance the services that we currently provide.